Hello and welcome to Health Talk. I'm Dr. Manny. Health officials have warned pregnant women to avoid traveling to parts of Latin America and the Caribbean due to the spread of Zika virus and the serious risk for birth defects. But with the new Rio Olympics and summer travel in full swing, what are we doing to prevent it from spreading here in America? Joining me now is the Chief Medical Officer at the March of Dimes, Dr. McCabe, to talk about what the organization is doing to help prevent the spread of Zika. Thank you for being here.
Thank you very much, Dr. Manny. It's a pleasure to be here.
I want to start right away, talk about the Zap Zika campaign. What is it?
So it's a social messaging campaign.
Yeah.
Hashtag Zap, Z-A-P, Zika. And it's really to let people know some simple things that you can do to protect yourself and your family from the Zika virus. So one of the things is use spray, keep mosquitoes away, make sure the spray is EPA registered,
right.
And a number of things like that. But the key thing is we want to educate the public so that they can protect themselves from this Zika virus.
You know, one of the things that the March of Dimes is always, you know, aside from giving great public health information, supporting research, but the March of Dimes also has been an advocate, if you will, for a lot of health issues. What do you think is going on in our federal government in regards to the funding for research and what's needed? What's going on there?
Well, we were disappointed. The March of Dimes put together a coalition of over 80 organizations interested in preventing the Zika virus from harming babies, really protecting moms and families from this virus. We were disappointed that Congress went out for its summer vacation without passing any legislation to appropriate funding for this. So we worked very hard, and to say disappointed is not saying it all.
Statement, right?
Yes.
What should we be telling women in general about conception, prevention, and if they were pregnant?
Well, women should plan to get pregnant. 50% of the pregnancies in the U.S. are unplanned. So we really think that part of the message is plan your pregnancy. Think about whether this is the right time for you to have a family. If you're planning a pregnancy and you think the woman has been exposed or have shown symptoms, wait at least 8 weeks until the onset of the symptoms before you get pregnant.
Right.
And use condoms.
Right.
Or don't have sex during that time. If the male partner has been infected, then we're recommending wait 6 months because it stays in the semen a lot longer than it stays in the blood. We know it's been documented for 93 days in one gentleman.
So we have sexual transmission through semen. We have mosquito transmission. Has there been any other ways of acquiring Zika that you know?
Well, certainly there's been one hospital worker, a lab worker, who was exposed. There is this case in Utah, we don't understand it, but a close family caregiver to an elderly man who died of Zika had very high levels of the virus in his blood. We're not sure exactly how that was passed. We're concerned about blood transfusions. The blood is being checked. The blood supply in Puerto Rico is being checked to protect against getting it from a blood transfusion. Concerned about solid organ tissues, like kidney transplants, liver transplants, if the person has been infected.
Right.
So it's basically exposure to blood or semen.
Right, and that's why important to get the funding from the federal government.
Yes, yeah, and there is one case where it appears to have been transmitted from a woman to her male partner. But in general, it's more common for it to be transmitted from the male partner to a woman.
All right. Last comment, because I want people to realize how much information they can get if they go into any portal of the March of Dimes. But tell me what people and what type of information is available through the March of Dimes when it comes to questions of Zika.
Well, go to marchofdimes.org/Zika. If they would prefer it in Spanish language, then it's nacersano.org/Zika. We update that. We've updated it 30 times since January 20th when we put the first article, web article up. So what I'm telling you is what we know today. It may be different tomorrow, and if it is, we will change it within a day. So stay on those websites. People are spending 5 minutes or more on the English website and close to 10 minutes on the Spanish website. So people are studying this. It only takes two minutes to read it. So people are studying this information.
All right, so I guess the last word, don't be afraid of Zika, but be informed about Zika.
Be informed, protect yourself. Microcephaly is only the tip of the iceberg. They're seeing babies who have no signs of microcephaly, no birth defect, but are then developing seizures, are having problems with sucking on a bottle or at the breast.
So neurological deficits that may not, exactly right. All right, well, sir, thank you so much for coming here and giving up this information. And any new information, please have an open invitation and update us in what's going on with this Zika pandemic. Thank you very much.
Thank you very much, Dr. Manny.
And remember, go to the March of Dimes website to get all the information. And if you have any health topics you want to talk about, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.